absorb. Something that also is super helpful is sulfur. And that's what the S stands for, methyl sulfur or something there. And that also is, sulfur is needed to build connective tissue. So those of you that have had any problems in your hips and your knees, this is the product that you want to start taking. Those of you who don't want to have this problem, now's the time to start taking it. There have been research studies done, and again, I have the studies that have shown that glucosamine will work better than NSAIDs. You know what NSAIDs are, everyone?
Anti-inflammatory.
Not sure, anti-inflammatories? For arthritis, and there's no side effects from this. Guess what the #1 cause of ulcers are? Anti-inflammatories. #1 cause of ulcers. So I would recommend those of you that who are over 40 or getting close to 40, this is something to start taking. Even if your knees and hips are not hurting you now, that's the whole idea. After 40 also, inflammatory disease often start to really show up much more so. Things like colitis and inflammation. Cancer starts to express itself usually after age 40. Omega-3s, curcumin, and ginger are things that block the inflammation. Vitamin D and vitamin E slow down cell division. So here we are again. I'm going to say this over and over again. Do we want to wait till we start getting these kind of things, or do we want to start working on it now? If you're not on the omega-3s, you must be getting on them. After age 40, and I think you'll agree with this, this is a good time to start doing something they call cross-training. So when I started, running, I didn't really know as much about this, and I really didn't start cross-training until more recently. But cross-training, you start using different joints, you use different muscles. It's not as big. Is that something you recommend pretty much also after age 40? For everyone, yeah.
Pilates.
Yeah, now, chiropractic after age 40 is going to help those joints from breaking down. Joints that are misaligned are going to wear out just like your tires that are misaligned are going to wear out. So it's just crazy. I mean, those of you who wait until you're hurting, I mean, that's the old way. I mean, those are the, I know I'm kind of preaching to the choir here, but chiropractic adjustments to people before they have arthritis may well slow down its progression. Usually after age 45, people are going to start saying, wow, I just don't have the energy I used to have anymore. And very often this occurs because the body does not, remember we talked about this before, the body does not convert food to energy as well. Remember we talked about Lipitor? Well, one of the greatest dangers of Lipitor is that it depletes the body of something called Coenzyme Q10, which is needed for cell energy. It almost ought to be automatic. Anyone here taking Lipitor? When you were taking it, did your doctor say you must take Coenzyme Q10?
No, he just told me to take Lipitor. I have to go for blood work every 30 days to check my liver.
This is a must. And this is something I started taking also more recently. More, like I said, I don't take Lipitor, but it's also just going to help your body to help the cells to build more energy, what they call cell energy, coenzyme Q10. We'll talk about that a little bit more so. Cardio and cross-training should be done after age 45, 4 times a week. Chiropractic adjustments can help lower blood pressure. Lower blood pressure. We've got things, this was from Cynthia Demos. I don't know if any of you have seen her on Channel 4, but she did a story on it. Man, lowering blood pressure, your mother-in-law. Yes?
Yep.
His mother-in-law coming to my office. His father-in-law had been a patient of mine. He's a professor at Miami-Dade. He had been a patient of mine for years and years, and about a year or 2 ago, he sends his mother-in-law in because her neck is so tight she can barely move it. And I guess I was very busy that day. I didn't do a great case history on her. In fact, that's one of the reasons we now have Dr. Francisco here. We want everyone to get a great case history and a great exam. So I check her neck, and I find that some of the vertebrae are out of alignment. They're putting pressure on nerves. And within 2 weeks, her neck is feeling much, much, much better. But she complains to me that I've been feeling tired since you started to adjust me. And without doing a case history, my mind started thinking that maybe her blood sugar's getting low or something. I want you to go see your family doctor and let him do a blood test. Let's check your blood sugar. Well, she goes to a family doctor, and the first thing he does, what most doctors do, I guess, when you're especially on blood pressure, is check her blood pressure. And her blood pressure was about 88 over 52 or something. And he said, I think I found the reason why you're too tired. You see, if you take high blood pressure medication when your blood pressure is high, they hope to get it lower to normal. But if you take blood pressure medication when it's normal, it's going to make it much too low. So she was able to cut her medication in half almost immediately, and she really should be off it completely, but I think she owns stock in one of the drug companies. But adjustments to the neck at this age, again, most people can get off of blood pressure. You know that there have been studies done at Stanford that say just walking 30 minutes a day, 4 days a week, will probably reduce your need for blood pressure medication. Age 50. This is when your immune system usually will start to weaken, and especially people who have been taking medications, all those medications you've been taking for all your lives, you don't just flush them out. Your liver detoxifies your body. Your liver has to clean them out of your body. And liver detoxification starts to become very sluggish after age 50. When that happens, your chances for cancer definitely go up. Antioxidants, if you've just been taking a minimum, now you definitely need to increase them. Milk thistle is a great way to detoxify the liver. It's something you can find in every health food store. George, that's something you've used?
Yes.
Something like that? And it's
Also used dandelion.
dandelion? Good. Anyone else has ever done any detoxification? The liver. George, tell her a little bit. George knows more about that than I do.
Well,
Maybe my son also.
Different herbs in, like milk thistle's one, dandelion. You can also put that in your salad, like the dandelion leaves, or you can create a tea. Just boil the leaves.
Something new. I want to talk about detox. Joyce was asking any other information.
I'm lucky I just get to say hi to everybody.
Well, and one thing I've done, because I had a lot of problems with my liver, is what they call a liver and gallbladder flush. Again, that you'll never see from a doctor, because that's, but over the centuries, a lot of cultures cleanse the different elimination organs, the colon, the liver, and the kidneys. But the liver, like in my case, I had a lot of gallstones, and I went to the ultrasound, it was packed. Normally what they do is they cut up your gallbladder, and your gallstones are gone. But what they don't say is you also have gallstones in your liver. And then Johns Hopkins University did a study and confirmed that you have gallstones also in your liver, not just your gallbladder. And I've done about 11 liver gallbladder flushes. I felt much better. I did an ultrasound. Gallbladder was clean. And even after that, more gallstones started to come out after the ultrasound, meaning that ultrasound didn't pick them all up.
Yeah. And most of them are going to be too small. And
So
most
did you
people
do
don't have
it
that.
once a month?
Well, you do it once a month, but you have to prepare for it. You don't just, you have to have a good diet, and it's like a week. You usually do it over a weekend where you stay at home, and you try to do it in a relaxed setting, because, you know,
Yeah.
it's not, you're not going to feel very good that weekend, but afterwards you will feel good.
Anyone? Any other thoughts on that, Dr. Colon?